Mr. Speaker, this morning I released a letter from 16 pathologists at the University of Alberta Hospital raising serious concerns about this PC government's massive privatization of lab services in Edmonton, including their independence, the, quote, widespread use of public dollars for private gain, and most importantly, they're worried about timeliness and quality of patient care should lab services be privatized. They're very serious concerns, Mr. Speaker. The government continues to privatize health care and to risk the health of Alberta families. To the Premier, why?
Well, Mr. Speaker, this honourable member's characterization is absolutely ridiculous. I am so proud of this health minister who's done incredible work in the past 4 months to ensure, Mr. Speaker, that we have patient safety and effective acute and long-term care, as well as primary care and preventative care, Mr. Speaker. That's an integrated health system, and it's unfortunate that this honourable member, if he has those concerns, would suggest to anyone that they should be afraid. We want to make sure patient safety is honoured. We want to make sure patients are protected, and that's why this health minister will make the right decisions in consultation with professionals to actually improve the health care system.
Mr. Speaker, I will quote from the letter signed by 16 pathologists, many of them professors in the University Medical School. They are concerned that this will impair timely patient care in an acute setting and reduce patient safety along with overall quality of care. The Premier has characterized this as scare tactics on my part, but I have a question for her. Why is the government not taking this seriously?
Speaker, that's a ridiculous characterization. Those concerns, which those professionals may have, are exactly the same concerns that this minister will have and this government will have when a decision is taken about whether or not to do what this member suggests is already happening. It isn't, Mr. Speaker. Of course we will listen to professionals. We're not going to create any uncertainty. We're going to move forward and build this province, respond to people that need help, ensure that that happens, and I have every confidence that this minister will do exactly that.
Honourable Leader.
Thank you, Mr. Speaker. In response to an earlier question from the Leader of the Official Opposition, the Premier said that Albertans in the last election had rejected private health care. Yet AHS is now planning to privatize medical lab services in the Edmonton region with a $3 billion contract to one private operator. Can the Premier explain the difference between her words and her actions?
Mr. Speaker, 18 months ago, this government, this progressive Conservative government, said that we stood by the fact that we believed in a public health care system, Mr. Speaker. We will continue to do that. That is what Albertans rely on. They can have confidence in that commitment. We do not change our minds from Monday to Friday, Mr. Speaker. We are not committed to ideology that would actually allow us to make decisions that didn't make a lot of sense. We will ensure that we have a publicly funded health care system that ensures patient safety and delivers services to Alberta.